Welcome to another of our Ardenwood Presents webinars designed to inspire and inform. Today we'll be talking about Medicare for Christian Scientists, and our presenters, Jim, Katie, and Nancy, will share new updates on Medicare plans that could be a benefit to you. So we're glad you're joining us today. I'm John Mitchell, and I serve as Executive Director and CEO for Ardenwood here in San Francisco. As a 501c3 charitable nonprofit organization, Ardenwood is an ever-expanding idea that supports the ministry of Christian Science nursing. It provides a place to receive skilled Christian Science nursing care and to experience healing. And it reaches out in service to the field through our visiting Christian Science nursing service, Christian Science nurses education and training, and online events like this one. Your support helps us provide the highest quality of uninterrupted care and outreach. You are invaluable to Ardenwood. Thank you. Now let's talk about today's webinar topic, understanding Medicare as it relates to a Christian Scientist. You might ask why Ardenwood is promoting Medicare. Well, we're not. Medicare is simply one option for those who are 65 or over because we have all paid into Medicare throughout our working lives. And here's a very important thing to know. There is no difference in the care you receive at Ardenwood or another Medicare provider, Christian Science Medicare provider, if you're on Medicare or not. Medicare simply comes into play when you pay your bill. I do want to mention the wisdom of giving thought to a care plan in the event of a need for Christian Science nursing care. If you have such a need, you want to focus your focus to be on God and on healing, not on how to pay for care. Thinking through your options in advance is very helpful, if not essential. Ardenwood is designated as a religious, non-medical healthcare institution, a RINKI for short, just an acronym. As a RINKI, Ardenwood is a Medicare Part A provider. One perception of Medicare is that it wants too much information about your physical well-being. As the payor, Medicare wants to ensure that the care received qualifies for coverage. In other words, your care needs would require a hospital setting if you weren't at Ardenwood or another Christian Science facility that includes Medicare Part A. We have found that Medicare is much less intrusive than most insurance companies. As you know, Christian Science nurses do not diagnose, so only general information is reported to Medicare. And finally, the content shared is only informational and is not intended to be legal advice. A replay of this webinar will be available on our website in the next day or so. As a reminder, you can ask questions using the Q&A button at the bottom of your screen. Now, let me introduce our presenters today. Jim Maher is a certified senior advisor and a broker consultant specializing in Medicare. He is also a certified long-term care insurance strategist. Jim has talked to more than 1,200 Christian Scientists since our first webinar, answering innumerable questions about Medicare, long-term care, insurance, and estate planning. He's been a tremendous blessing to our field, and we're grateful. And from what he's told me, he has loved meeting and working with all of you. His associate, Katie Burris, is a Medicare specialist and certified long-term care consultant, helping individuals with their Medicare and long-term care planning strategies. Katie is a partner at McGrew & Maher Insurance Services and has been in the business for 17 years. She is licensed for life insurance, long-term care, and Medicare in several states. Nancy Sedan is Ardenwood's Director of Finance and has extensive experience with Medicare in the perspective of our Christian Science nursing facility here in San Francisco. Welcome to you all. Let's get started, Jim, Katie, and Nancy. It's all yours.
All right. Thank you, John. That's always a really nice introduction. Appreciate that. Love having Nancy on the call too. That's great today too, Nancy. Thank you.
Nice to be here. Thanks.
All right, so we'll get started. We've got some some big changes coming up, some for the better, right? Quite honestly, we're going to talk about the government actually reducing premiums, right? You heard that correctly, reducing premiums. So John kind of went over a little about our information. I've been doing this is my 33rd, going on 34th year of helping people with Medicare and other long-term care, things like that. And it's great working with Katie. You know, Katie, between us, we've got like 50 plus years talking about Medicare. So we absolutely love it. Love working with Christian Scientists, like John said, absolutely love it. We hear from people all across the United States, Christian Scientists, and it makes my day, quite honestly, to hear from everybody, trying helping you and educate you. And we're trying to learn, right, Katie, about what to say and what not to say. We're so geared up for the non-Christian scientists. So I've tried to pull back and not get too carried away talking about specific illnesses or anything. So Nancy will keep me in line too. So
we are broker consultants. We specialize in Medicare and long-term care. It's important to note that we are not affiliated with Medicare, Social Security, or any other government agency. Our goal really is just to help mitigate healthcare costs in retirement.
Right, that's exactly right.
So the agenda for today, we're going to go over the basics of Medicare. We're going to go over Medicare changes for 2023. So any of the font that you see in green is just letting you know that those are changes that have happened for 2023 so that you can visually see that. They are updating enrollment periods. So a couple of different enrollment periods are having changes, and we're going to go over that.
Mhm.
There's going to be updated premiums and deductibles for next year because we already have those numbers. And then we're going to go over what's happening now, because every time you turn on the TV, the radio, anywhere you look, you are seeing different commercials for different insurance companies. And that's because Medicare is having their annual election period. They also call their open enrollment period interchangeable terms, and that takes place from October 15th through December 7th, and changes are effective January 1st.
That's exactly right.
So Medicare basics, the parts of Medicare. Original Medicare, that red, white, and blue card you get, has two parts to it. Part A is the hospital or the Rinky side of things. And again, religious non-medical healthcare institution is what Rinky stands for. And then part B is the medical insurance. And then Nancy, I know we were talking about, before the presentation, we were talking about the question that we get from a lot of Christian Scientists is if they stay at Arden Wood, where does that fall for Medicare?
Yes, it's very important to understand that all you need for care at Arden Wood or a Rinky is Part A. And that, so long as you have worked some during your life and you're over 65, you're going to automatically have Part A, and there's no premium cost associated with it.
That's right.
And I should also say that Part A covers the room, board, and nursing care at Arden Wood. So Part A is the one that you need if you want to have care at Arden Wood that's covered by Medicare.
Okay.
Perfect.
Very good. So now we're going to talk about the initial enrollment period. That's next. So everybody goes, what is that? Well, Medicare says you're supposed to know when you turn 65 that you have this thing called an initial enrollment period, which nobody knows about. You know, most people have been on an employer group plan or a spouse's plan, maybe as early as in their early 20s, all the way to 65. And now they're supposed to know, Katie, what does initial enrollment period mean? It's when, if I'm not on a group plan, right, with more than 20 employees, I really need to enroll for Medicare or I'm going to face fines in the future. So they give you this 7-month window, and things are changing for the better going forward in 2023. So my birthday was October 5th, right? And I just actually, I'm on Medicare now I'm telling people about it for 33 years. Now I'm actually on Medicare. So that meant I can enroll as early as July, 3 months prior, right? The month of my birthday, October, and 3 months after. But for someone like me that's on a, we don't have 20 employees or less than 20 employees, so I must enroll for Medicare at 65 or face the fine. So normally it's kind of, if you enroll after the 4th month or 5th month, this year they make you wait a couple months. Like if you enroll in the 5th month, that you may not have coverage until the 8th month, or the 6th month, it could be the 9th month. Don't ask me why they do that, but they do. So next year, common sense actually set in. So if I enrolled, for example, in November, my coverage would be effective December. If I did December, it would be January. So they actually made it easier for people to understand finally. So no more of this trying to figure out if I don't enroll by the 4th month and the 5th month, it's 2 months and 3 months. It's easy. They made it easier for everybody to understand.
And enrolling into Social Security requires that you have Part A of Medicare. So
Right.
if you are on Social Security and you're over 65, you are required to have Part A of Medicare.
So and that's, we see that a lot too, because people sometimes I'm talking to them, or Katie, we're talking about their initial enrollment period, and they go, Jim, I got this envelope here from CMS, Centers for Medicare and Medicaid Services. And I go, well, you should open it. It's my Medicare card. I didn't sign up for it. So that tells me that they're receiving Social Security or railroad retirement benefits. We're out here in Northern California where railroad retirement benefits are big through Southern Pacific up here in the Roseville area. But you have the option. So if I'm still working, if I'm working, for example, like at Arden Wood, an employee of Arden Wood, I would have to keep my Part A because and like Nancy said, most times it's premium free, right? There's no additional cost for it, but I don't need my Part B. And if I'm going to be working still full time somewhere, I don't want to pay for that. So you can actually tell Medicare that I don't want my Part B right now. I don't need it. And since I'm working for a larger group, or my spouse is, then I won't be penalized. So that's important.
So if you're over 65 and you are working, again, Jim has mentioned, if you're working for an employer with more than 20 employees and you're on their group plan, which a lot of Christian Scientists that we talk to are in that position, you do not have to enroll for Medicare when you turn 65.
That's right.
You can wait till you retire, and then that's when you qualify for what's referred to as a special enrollment period.
Right.
So the month that you lose coverage through your employer or through your spouse's employer, then you are eligible to enroll in Medicare Parts A and B for 8 months. I want to walk back a second and talk about if you are over 65 and you are covered on a domestic partners group plan, that special enrollment period does not apply to you.
That's right.
Medicare does not look at domestic partners the same as they do spouses.
That's a really good point. That's a big point right now. And from doing this for so long, quite honestly, I was trying to think, I don't think I've ever had anybody wait 8 months to enroll in Part B. Normally if they have A, and so if I'm going to retire, let's say this December, I am not going to wait until December 28th to call and say, how do I start my Medicare Part B effective January 1? Nobody does that. Most people are planning months ahead. The government gets really busy during the holidays, and you can expect delays. So you always, it's prudent to start months ahead. I always tell people, if you know you're going to retire and I'm 67 or 68 or beyond 65, doesn't matter. You want to give yourself at least 4 or 5 months to make sure that you've got everything set up to the way you want it, right? As a Christian Scientist, we know it's all an individual choice or decision, but you want to make sure you understand your options and move forward with a plan, right? Not just, gee, it's the end of December, I need to do something.
So if you do not enroll during that initial enrollment period when you turn 65, let's say maybe you were still working, you retired, you're so excited about retiring, you forgot about Medicare because it's not necessarily the funnest thing to talk about. So you would qualify then for what's referred to as the general enrollment period. That happens every year. And this is for people that need to enroll in Part A and or Part B of Medicare when they've missed those other enrollment periods. It happens every year from January 1st to March 31st. And until this year,
all right,
you applied between January 1st and March 31st, and your coverage started July 1st.
So I don't know where that came from. Nobody seems to be able to tell. I'm firmly convinced that, so Medicare says, listen, if you didn't enroll for Part B when you were first supposed to, there's a penalty, and the penalty is pretty severe. It's 10% of the Part B premium. So this year it's $170.10. So it'd be $17, just about $17 for every 12-month period that I should have signed up and didn't. Well, I'm convinced that, gee, this year, if I was going to, and I had to wait till July, that could create for example, a 30% penalty instead of a 20% penalty. But finally, good news, right? This is a big change. And we talked to a lot of Christian Scientists throughout the United States. This can only help you, okay? It's not going to hurt you. So if I waited now, signed up in January for that general enrollment period because I didn't enroll for Part A or B only, I don't have to wait until July. So if I sign up in January 1, my coverage will now be effective February 1. If I sign up in February, it's going to be effective in March and so on, right? All the way through April 1, which is awesome. We've talked to quite a few of you actually, and I know you're going to enroll for the general enrollment period, but it's going to save you. If it saves you another 10%, that's awesome, right? Thank God the government is doing something good for everybody. Really, seriously, that's awesome. I think that's really great, and that helps a lot of Christian Scientists.
So Jim, can you clarify, Part A does not need to be enrolled in, right? You automatically get that, is that right?
Oh, Nancy, I know it's super confusing. So the only way you're automatically enrolled on Part A is if you're receiving Social Security benefits or railroad retirement benefits. If not, you must enroll. That's the confusing part, right? People just don't, nobody tells them. They're supposed to know that. So the only way, again, that you get Medicare is if you're on Social Security or railroad retirement benefits. If not, you have to go to the Social Security office, or we're going to show people how to do that later, but that's, yep, you have to take action.
So Medicare Part A, we know covers you in a hospital or a rinky, just like Arden would or any other Christian Science facility, as long as they participate with Medicare. It's premium free. I know Nancy mentioned this. If you or your spouse worked and paid taxes for 10 years or longer, and the coverage is nationwide. So you can use it for any religious, non-medical healthcare institution in the entire US that works with Medicare.
Right. I look at that. That's super important. I grew up and my dad worked, and my mom, she worked harder because she was a homemaker at home. So I learned long ago, you don't say somebody didn't work, right? Homemakers work usually harder than who's actually out in the employment. But that takes care of somebody like my mom. Since my dad had worked those 40 quarters, then she was protected by my father being that. So she was able to get both Part A and B, and there was no cost to her. Well, Part B had a cost, but there's no penalty or anything like that for having A or B.
So if you have Medicare Part A and you end up in a rinky, and it's a Medicare approved stay, Nancy's going to talk about that, the deductible for the first 60 days for 2023 will now be $1,600. Starting on day 61, you have a $400 per day cost. And from days 91 through 50, it would be $800 a day. And those are referred to as lifetime reserve days, meaning those 60 days between 91 and 150, you can use once in your lifetime.
Right.
And Nancy, I know a lot of people have questions about a Medicare approved stay, and you kind of touched over that a little bit earlier.
Sure. So in order for Medicare to pay on your behalf at a rinky, your care need has to be similar to what a non-Christian Scientist might go directly to a hospital or a skilled nursing facility, is sometimes referred to as a SNF. So if your care need is equivalent to those types of needs, then this will pay at Arden Wood as well.
Right. Nancy, what happens, we talk a lot of times about somebody after 60 days, like the benefit period is not calendar year, it's for a duration of time. So if I experience spiritual healing, for example, at Arden Wood, and let's say 4 months later, I need to come back for more spiritual healing. tell me what happens then. Do they have to go through and meet that deductible again, that $1,600?
They do, yes. So it's they call them episodes. And so long as there is 60 days in between, quote, episodes, that Medicare clock of counting of days begins again. And that's beneficial because you have additional Medicare days that'll start again. And having 60 days of care with just simply a deductible of $1,600 for 60 days of care is helpful for many people have found.
Okay.
So I actually had a question today from a Christian Scientist. Their specific question was, if they go in and let's say they're in the Rinky for a couple weeks and then they leave for a few weeks and come back, how would that work as far as billing for Medicare?
Yes, it's a great question. Medicare requires a 60-day lapse between leaving a facility and coming back for a new, quote, episode to begin again. If there is less than 60 days in between, then the count of this 101 to 150, that count resumes and picks up where the first stay left off. So for instance, let's say they were here for 25 days and then decided to go home. But the next month they decided they really would like to come back for care for that same need. So when they return, the care period, the episode would start on day 26.
Oh, okay.
Thank you.
Okay.
I appreciate that because
Right.
I know that was a specific question I had today. So as far as costs, so with Medicare Part A, if you did have a stay of 150 days in the Rinky, you would pay $1,600 for the first 60 days. You would pay $400 a day starting on day 61 for a total of $12,000. And then $800 per day for days 91 through 150, assuming you still have those lifetime reserve days in force that you can use. And altogether, that 150 days would be $61,600 would be your portion that Medicare would not cover.
And let me just interject there if I could. Of course, we are never expecting anyone to need to be here 150 days.
Right.
But if there ever was a need, this is what your cost would be.
Yes.
And so that's just important to realize.
Right. I always like to prepare, expect the best and prepare for the worst, just in case.
So Part B is the medical insurance side of Medicare. There is a monthly premium for that, and it is adjusted for income. They call it an IRMA. We'll go over that in a minute. The premium runs, so for 2023, it will be $164.90 as the base premium, and it can be as high as $560.50 a month per person, depending on your income.
But the good news is that number went down. Okay. So when's the last time the government has actually done it? I mean, they've done it years ago, but seriously, they went down from $170.10 a month to $164.90. So at least it didn't increase, right? For most people. And we're going to talk about this adjustment for people with higher incomes in a minute here. So like Katie said, the good thing with Medicare coverage is nationwide. Any provider who accepts Medicare, right? Just in the event that you're traveling, you have an emergency, a fall, a fainting spell, something like that, and they do take you into an emergency room for treatment so you can get out of there and experience spiritual healing, right? At a Reiki, hopefully. But we want to go over those numbers for you. Katie, she did a great job. She put them in a different color, and I'm colorblind, but I know they're a different color. They're green. But these are the premiums going forward for 2023. 94% of the population is going to pay $164.90. The other 6% is going to pay a higher cost based on income, right? On their income. So how does that work? Because most people go, well, gee, if I worked last year, I made X amount. Take us through how that applies now to people turning 65 or applying for Part B in 2023.
So Medicare always does, excuse me, a 2-year look back. So for 2023, to figure out what your premium is going to be, whether you're new to Medicare or you've been on Medicare, they're going to look at your 2021, so 2 years ago, 2021 tax return. They're going to use your modified adjusted gross income, meaning they take your adjusted gross income and they add things like tax-free muni bonds, stuff like that back in to possibly increase that number.
Right.
And then the monthly premium amounts we're talking about are per person.
Right.
So
Yeah.
if you're a couple, then let's say if you're in like that third bracket, that $329.70, if you're both on Part B, you would both pay that each month. And anything from that second bracket down is considered an income related monthly adjustment amount, or an IRMA is what it's referred to commonly. And so that's what you'll see is you'll see both spouses would be paying that amount.
Right. Assuming they file a joint
Yes.
tax return, which most couples do file a joint tax return. So here's the good news. It's not forever, right? So if I'm a higher earner and I have a higher earner, and let's say I'm going into 2023 and I retire and I have a really good salary. Well, guess what? The good news is that Social Security, who handles the enrollments and the money side for Medicare, they'll look at that. So if I was a higher earner and I lost a pretty hefty salary, they'll look at adjusting it then, right, next year. And we actually have the forms for that, which we can send out to people, but it's a life-changing event, work reduction, work stoppage, they call it, things like that. So they'll take that into consideration right away. So don't think that you have to pay on that forever. So our goal is to help you try to get that reduced as quickly as possible.
And they're not going to reduce that automatically. You have to request that. You can actually call them. Sometimes they'll actually do that over the phone. There's forms. So in case you call or you would rather just submit the form that shows that you had that life-changing event, and then Jim's correct, they can actually change that premium instead of having to wait a couple years for
Right.
them to do that 2-year look back to. So if 2023, if your income changes, you don't want to have to wait till 2025 for them to
Right.
run your income from 2023. Ask for it now, get it lowered now, and save yourself a couple years of those
Right.
higher premiums.
It doesn't hurt to ask,
No.
right? It's easy to ask and allow them to help you. And I've seen so many examples of higher earners that, actually called. I was actually on the phone with a orthopedic surgeon who did it, and they reduced hers, right? She told them the truth. Hey, I'm leaving my practice. I'm not going to have that income. And they took that into consideration for, I was shocked, but they did, right? And they helped her right away. So we always encourage people, try. Or we have the forums, you can call them if you like. Sometimes, I think these government employees are pretty awesome because they have to deal with people all day long. Sometimes you find some really empathetic ones, and that's who you want to help you, right? So.
And when you're signing up for Medicare Part A and Part B, you're going through Social Security. You're not going through like a Medicare office. You're going through Social Security, and you can call them and sign up. You can make an appointment. Jim did that.
So all these years, we always tell people the easiest way to do it, quite honestly, right, is you go through Social Security, the Social Security website. It's real simple. You can go on and create an account and enroll through ssa.gov. Well, I had gone on a couple of years ago and created an account, and the old email address was no longer active. So I'm pretty good. I called them. I said, I'm going to make an appointment. So I went to the local Social Security office here in Roseville, California. They were awesome. They were better than I could have expected or hoped for. I timed myself. I went in there to enroll for A and B. They had my information. I gave it to them. 4 minutes, I was out the door. But I was very organized. I knew everything that I needed, everything. They checked it and they said, you're good to go. So it was a great experience. It really was. And we're always encouraging people, do it what's ever best for you, whether it's an in-person appointment. Sometimes that's easier because you can ask questions. Sometimes people get intimidated online, right? They jump online, they go, gee, I'm not sure how do I answer this particular question? Am I still working? Am I on a group plan? I think sometimes in person really makes it easy. You can also call them. I think we have the numbers on here. It's 800-772-1213. And I think we have that number. That's Social Security's main number. You can Google that or whatever you use to find out. But they're really helpful. I think people used to say they're not very good. I've found just the opposite, that you've got a lot of employees that are really caring and go out of their way to help you. So.
And then the last option is going on to their website, ssa.gov, And there is an option through their website to sign up for Medicare without having to sign up for Social Security, because you don't have to do both of those simultaneously.
And I'm not sure if we have a slide there, but you
I
can
don't
always
know that we
call us
do,
or
but-
email us and we'll help you too. We'll send that to you. Yeah.
So when we talk about that Part B, that 10% penalty, it's coming from that number, that 164.90. So this is where we're talking about where that 10% is coming from. So it's not just 10% of a random number, it's coming from the Part B premium amount.
So that's why my wife always goes, why do you get so excited? I get excited because next year, right, that can save you money. So a lot of you are going to call and say, well, I need to enroll in that general enrollment period. And that can save you. Maybe you have a 10% penalty instead of a 20%, it's still only 10%. So that's a good thing. Remember, instead of having to wait to July now. So the key is, if you think this applies to you, we should have a conversation in November, December, so we get you prepared for that, for the general enrollment period, so you know that you can make it effective February 1, not wait. You don't want to wait any longer. If you waited this long, we want to try and help you not create a larger penalty. Hopefully I said that right, if that makes sense.
And of that 10% penalty, we should note that 10%, so if let's say you have a 10% penalty, so you're talking $16.49, are probably going to round it up to $16.50. That is added every month to your Part B premium for the rest of your life.
Right.
So that's not like a 1 month penalty or 1 year penalty. It's added on every
Right.
month on an ongoing basis, just
Right.
so you know that.
So that's why it's important to keep it down instead of 32 or whatever it's going to be. We want it less. So we want to help you avoid the higher penalties.
So Part B, the medical insurance, covers a lot of items. In red, you can see when I'm talking or when we're talking to Christian Scientists, the most common things that we see are if they need an x-ray, they need a bone set. If something happens and there's like an emergency and someone calls 911, they're taken against their will. Maybe they've passed out,
Right.
they're gone, they've been taken in an ambulance to an emergency room, are kind of really the most common things.
Right.
And those fall under Part B of Medicare. So if you don't have Part B, you would pay the full cost should something happen.
Right.
If you have Part B, it does kick in and cover some of the costs, and we'll go over that as well.
Yeah, and Katie's right. Those, that highlighted there, the X-rays, X-rays aren't as expensive as some MRIs and CT scans we see. You see them billed, I see them at $10,000, $20,000. It's crazy how expensive these can be if you don't have Part B. At least even if you have Part B of Medicare, it's the old 80-20, right? After the small deductible, you're on the hook for 20. But at least it's 20%. I'd rather pay 20% of even $40,000 than I would write a check for $40,000, quite honestly. So you always want to look at least activating B just in case, right? If you have an accident, they take you there. And the other thing that's important too, Nancy, and you got to tell me here, I don't want to, but it's important. COVID vaccinations, flu and pneumonia vaccines are all covered under Part B. So those are covered in full. And I know that that's a personal decision, right? For Christian Scientists to decide if they want to get those vaccines.
That's correct.
Okay, yeah, but it is covered.
And they're in green because that's new for
Right.
2023.
Yes.
Part B. So if you have Part A and Part B, and you have Part B with no insurance on top of it, for next year, it's a $226 deductible. That is actually down from this year.
That's a good thing. That's it, right? Yes, it went down. Instead of, right, this year, $233, at least it went down. It's better to go down than up. So that is good. So it's $226.
And then after the deductible, you would be responsible for 20% of the cost. The problem with that is that there's not a cap on that.
Right. That's a big deal. Cap means, like, when you look at your group plans now, many of you are on group plans or coming off group plans, you have what's called an out-of-pocket maximum, meaning that I cannot pay more than $5,000 or $7,000. It's somewhere normally in that range. The problem with Medicare is there is no cap. So if something happened to me where I experienced I know John talks about a fainting spell, right? And they take you to the emergency room. Well, I'm on the hook. If I just have Part B, I'm on the hook for 20%. Well, if later that year, if I fall, right, and I break a hip or a knee, and I go back in for outpatient care under Part B, I have to pay 20% again. It's not like, gee, I've already paid you, $8,000, leave me alone. I now have to pay 20% of whatever that Medicare charge, adjusted charge would be in that emergency room. So we just want people to be aware of that there is no cap.
So Medicare doesn't cover everything. We talked about it doesn't cover all of the cost of your care. You have those deductibles, you have the per day costs on Part A. Part B, you don't have that cap. It doesn't cover prescription drugs. It doesn't cover routine dental, vision, or hearing care.
That's the number one. We get that asked all the time. What about dental? Dental and vision is the number one asked question when we talk about Medicare. Does it include dental and vision? And it does not, right? They tried to. I know they tried to negotiate again and put it in there. It just didn't quite make it this year. So hopefully in the future, they'll add it in.
Medicare does not cover long-term or what's referred to as custodial type care. We talked about that last week. If you have those activities of daily living that you need help with, Medicare does not cover those, and they do not cover care received outside of the U.S.
So, and this is important, for non-Christian scientists, we always ask me, what about Canada? I go, well, Canada's not part of the U.S. What about Mexico? Mexico is not part of the United States or its territories. So if you do travel outside and you're on Medicare, normally we always recommend some type of a travel policy, right? That covers you if you're in another country, if you're in Israel, Canada, wherever you go, that coverage, it's going to provide you coverage there. And it's really low cost, right, Katie? It's not super expensive. It's actually really pretty low cost.
So what we get most often is people also ask about supplemental or insurance coverage with Medicare. So once you're enrolled in original Medicare and you have that Medicare card with Part A and Part B, most Christian Scientists look at getting a Medicare supplement insurance plan, and then some decide whether or not to do a prescription drug plan. Most don't. That's fine.
Right.
So with a Medicare supplement insurance plan, they also refer to it as a Medigap policy because everything has to have 2 or 3 names it goes by.
Right.
It helps pay the costs that are not covered by Medicare. So it's a supplement to Part A and Part B. They're offered by private insurance companies. And in your state, some states are slightly different. Most states have the same exact policies, but it helps limit your costs if you're in a rinky or if something were to happen with an emergency that you had to go in an ambulance, something like that. You have to be enrolled in Medicare Part A and Part B, and it's nationwide coverage. There's no provider network.
Right. So what that means, no provider network. So most people coming off a group plan are used to a PPO or an HMO type plan, meaning you've got to go to some kind of network of physicians. Medicare is awesome because there is no network. You can simply find a provider, right, that helps if you're traveling and you need some type of care, that you have original Medicare, that little red, white, and blue card, and that's your ticket in the door, right? Whether if I'm on a rinky at Arden Wood or something happens to me, I'm traveling, I'm seeing family in Austin, Texas, or Orlando, Florida, it doesn't matter. Medicare is nationwide, and that gets you in the door, right? You don't have to worry about, are you a PPO or HMO provider?
They are guaranteed renewable, which is really just a fancy way of saying, as long as you pay your premium, they cannot go back and cancel you because you had a claim, because they had to pay out something to you or for you. They cannot go back and say, hey, we're going to cancel Jim because you had a large claim, something like that. They can't do that.
Right. People, well, my dad was a great example as he aged, and my father made 102, by the way, so he really did age. So, but he would worry about, well, gee, if I use my insurance, it's, well, they cancel me. And I go, Dad, they can't cancel your coverage. People worry about that, and they go, you should never worry about it because the insurance companies protect you. It's guaranteed renewable. If I'm in a facility or a non-Christian Science facility for a period of time, they can't turn around to me and cancel my plan. They can't single you out. So you're guaranteed coverage. It's guaranteed renewable as long as you pay the premium, right? you're good.
And Jim and Katie, can I just add, just to tie back to what you said earlier, here at Arden Wood, if you did need care under a Part A, you remember that number of $61,000. This is the type of policy that would help, not help, it would pay those amounts. So you could come to Arden Wood if you had a Medicare supplemental policy as well as Part A, and you wouldn't have to pay anything during that time that you were here. So for some people, paying the premiums for a Medicare supplemental policy and knowing that in the future they wouldn't need to, that both Medicare and the supplemental would cover all costs. To some people, that is worth going and also having to buy the Part B.
Absolutely, it is, Nancy. We totally agree. This next slide, this is going to lead right in for you. We're actually going to talk about, these are the plans. And we talk about under Part A, you can see there, what if I did have to stay? Plan G is the most popular that we see now. It used to be Plan F, but now it's Plan G like George. You can see that Part A hospital coinsurance, it's covered at 100%. And so you purchase a supplemental plan from the insurance company, and that's what we do. We help you enroll to help you with that. But this Plan G, Nancy, if they come into Arden Wood with that supplement, then they would be covered in full then for that Medicare approved stay.
So we talked earlier about those numbers, and like Nancy said, so if you just have Part A of Medicare, those were the costs we went over. But let's say you have that Medicare Supplement Plan G, they cover you at a zero copay for up to 300, for up to a continuous 365-day stay. That's not very standard that we have like ever seen,
right.
A 365-day stay, but the supplement would pay up to that
right.
timeline.
And we're just here to educate you today. So you're smart people dealing with Christian Scientists. You're smarter than most people, and we just want to make sure you understand you have options. But you know, we joke about writing a check for $60,000 or $20,000. That's not easy to do. I mean, sometimes I have a hard time writing a check for $800. I mean, my wife is very frugal and prudent, and you know, if I can pay a smaller premium to know peace of mind, if I do need it for care, I'm paying zero. I don't have to worry about it, right? So we just want to make sure you understand your options. I think a lot of Christian Scientists weren't presented options years ago, and this is still on the table for you. So you look at that, and it's a personal decision to decide, is that best for you to protect your finances down the road?
So Medicare Part B, we went over that deductible. After the deductible, the 20%. If you have that Medicare Supplement Plan G, then what happens is there's no 20% after the deductible.
That's right.
Once you meet the deductible, the insurance company would cover that 20% cost.
Right. That's a great deal.
Mm-hmm.
I mean, I don't mind writing a check for $226. If that's going to be my
That's your limit.
total exposure next year, I'm absolutely good with that. Anything Medicare approved after that, I'm paying zero, whether it's an emergency room visit. And remember that no cap, that's a big deal. Supplement Plan G gives you your cap, and your cap is $226. That's a really good number, much easier to write a check, right? I'd rather be able to, quite honestly, pay that, and instead of spending $60,000, I'd rather be able to help my favorite charity, right? If I needed to write a check to them versus paying it out for care. So,
and this may be a good time to pause for a second and talk about, I know Nancy, we kind of briefly touched on it last week, but we said we would go into a little more detail about an advanced healthcare directive and how important that is.
Definitely. Yeah, thanks for bringing that up. An advanced healthcare directive is a document that allows you to determine ahead of time and make public to your whomever you decide to share it with what your wishes are should you have a need and not be able to verbalize your own wishes. So so that is a document that Christian Scientists have found very helpful to have in place. So for instance, if you're in a public location and something happened and 911 was called, you might find yourself waking up in a hospital. And in order to be able to come to a rinky, This document would enable you, would give your designated proxy, if you will, whomever you've chosen, the authority to go to the hospital and indicate that this was indeed your wish, was to be cared for at a rinky, not in a hospital. Otherwise, that might not be possible, and you'd end up staying longer in a hospital than you wanted to. So having this designated ahead of time in writing, and available to your whomever you choose to share it with, so they know that it's there, has been very useful to many people that we've come in touch with. We also have this on our website. We have a form, a blank form that you could use to just have a sense for what's involved. It's been reviewed by California attorneys. If you're in another state, you would probably need to take it to attorneys in your own state to make sure it was right for your state. But it does give you a sense for what the questions are and the kinds of things to determine to finalize.
A couple of things we recommend to clients that I've done myself as well. So with my mother, for example, I'm her healthcare directive. I would be the person that would be making choices if something were to happen. She let me know that. So it's always important to let someone know that you want for them to be your proxy. And she also gave me a copy of it so that I have it, because if something were to happen, I need to be able to access that quickly and not go try to tear her house apart trying to find out where that is. So having whoever has your proxy or your healthcare directive, you would want to be in charge. Make sure that they know that and that they have a copy, so that, or at least they know where a copy is that they could readily get to in the event that they need it.
Right. I know,
We've even seen an electronic copy has been extremely helpful. One of our patients had shared their directive with our visiting nurse, and so she actually, the visiting nurse, had Christian Science nurse had a copy of that directive, and it was extremely helpful in being able to determine good care for that individual.
so important. You know,
having it is one thing, but being able to actually access it and use it when you need it is the most important thing.
We've seen a lot of people, especially if you're single, right, living alone somewhere, that you even have a copy on your refrigerator, right? Just a note, you know, and just say, hey, this is my healthcare directive. Because if they do come into your apartment or your home, normally, you know, paramedics are going to look there for important information. So that's not a bad idea either, right? It's better to have more copies available than less. Okay.
So Medicare Part D, you'll hear a lot about. You're going to hear a ton about it right now because it's part of the Medicare, that annual election period. So Part D is the prescription drug coverage. It helps to cover the cost of prescription drugs. Coverage is optional, but you may be subject to a penalty if you purchase it at a later date. The plans are offered through private insurance companies, not through Medicare. And there's two ways to get coverage. It's a standalone plan if you have original Medicare. Whether you have original Medicare and a supplement or just original Medicare, it would be a separate policy altogether. Or what we see is some Christian Scientists don't realize that they have prescription drug coverage because it's built into a Medicare Advantage plan. We're
going to talk about that. So this slide, for non-Christian Scientists, this is really important. We pull it up and we probably have 3 or 4 pages for non-Christian Scientists. But we understand it's a personal decision. Before Nancy, when I first started, what was it, 3 or 4 years ago, I'm like, oh, you have to look at this, you have to understand it. Now we totally understand. It's a personal decision, it's up to you. But here's the thing, Christian Scientists don't realize, if I purchase, you know, one of those plans that Joe Namath is advertising on TV, that it's free and you get all this stuff, and we've seen so many Christian Scientists go, well, gee, it doesn't cost anything, I think I'll get that plan, right? They were sold, they didn't buy it, they were sold that, gee, it can only help you, it can't hurt you, it costs nothing, you might as well get it. And then we get calls on saying, why am I getting this? I'm getting this letter saying that I owe money now for some kind of penalty.
I was told it was free, but now I'm being charged.
What is that? And it's because if I'm a Christian Scientist, and let's say I'm 75 and I haven't never had Part D coverage, and I get one of those plans, it's, you know, the Medicare Advantage plans. The next slide, we're going to show that, and that's included. So if I haven't had it, the government's saying, well, wait a sec, you haven't had that for 10 years. So we're going to fine you for 10 years worth of not having Part D. So as a Christian Scientist, you have to understand that you just weren't told that. I mean, there's no other way to say that they didn't do enough, ask enough questions about that it's included and would be a penalty, unfortunately. The other thing that's important, and I know we've talked to some people that may be in a marriage where there's a Christian Scientist and a non-Christian Scientist, is that these new vaccines, especially the shingles, is covered under Part D. So if you don't have Part D, you're paying for it out of pocket. Next year, it's going to be covered in full. Right, so that's important too.
Unfortunately, they can't ever, like, Medicare can't ever keep anything simple.
It's never simple.
I'm pretty sure they make it as confusing as possible.
Right, but that is a lot of you have said, hey, how do I get out of that? So what's happening now, they call it the annual enrollment period, annual election period, Medicare open enrollment period. It all means the same thing. It's from October 15th through December 7th. So if I've got one of those plans and I've been paying a penalty on it and I don't want that anymore, Katie, now's the time they can do something about it, right? I can call and I can get rid of that Medicare Advantage HMO type plan and go back to original Medicare. And by doing that, I would drop, right? That plan drops and I don't have that Part D I don't have that penalty any longer, right? It's going to go away.
And then once you go to original Medicare, so that change would happen January 1st, you could then at that point decide, I'm going to have original Medicare, Part A and B. We
Right.
talked about those costs if anything should happen. Or you have the option to say, I want to look at picking up a Medicare supplement type plan at that time.
Right. But it's a lot of you, and I know John's, that's important to understand for Arden Wood too, that these plans don't work well, right, Nancy, at a Christian Science facility like Arden Wood. So we're going to show next. Let's show next about the Medicare Advantage. These are the plans you see advertised. Medicare calls them Part C plans, but they advertise on TV. I mean, I see companies out there right now. They have infomercials. I mean, I get up really early in the morning, turn on, and there's infomercials on these plans that play over and over again. They sell them to you that there's no cost or low cost. You get dental and vision and hearing. And if you're a Christian Scientist, what they forget to tell you is, see that little RX on the bottom of that card there? That means that includes prescription drug coverage. So if I haven't, you know, I use that example, if I'm 75 or 70 or 80, it doesn't matter, and I purchase that, I'm going to get dinged by the government. I'm going to get penalized because technically I'm signing up for a Part D plan. It just happens to be on this all-inclusive Part C plan.
And Jim did mention that now is the time of year. So if you go into your wallet and you notice that it says something like HMO or PPO,
Right.
and has that Medicare RX symbol on it, like you see on the bottom right of that card, that means you're on a Medicare Advantage plan. And unfortunately, we talk to a lot of Christian Scientists who just aren't aware that that's what they're on, either because they didn't understand or it wasn't explained correctly to them. But if you notice in your wallet that you have a card that says something similar to this, we would be happy to help answer questions about your policy or plan, or, you know, anything that you have on that.
But in the middle there, not Rinky friendly is very true. Right? John has talked about how long they delay and can delay, right, Nancy? Sometimes years before you can get paid.
Correct. I think one important thing to remember is if you're signed up with a Medicare Advantage plan, they say that all of your Medicare benefits are available to you. However, no Medicare Advantage plan actually has a Rinky as a provider within their network. They also, Medicare Advantage plans require that a physician authorize your care. And so we, if someone comes to us with a Medicare Advantage plan, we actually have to go through a lot of steps to try to get an authorization from that Medicare Advantage plan, and they don't understand who we are, why you have a right to be here. And it takes quite a bit of time and effort. And sometimes we're successful, sometimes we're not. The times we are successful, then when we go to actually try to build the plan, they don't also recognize us at that point. And we have to go through an appeal process to get paid. So it really is not a friendly setup for Christian Scientists that wish to use their Medicare benefits at a Rinky. The original Medicare plan Part A and just Plan A, Part A, excuse me, is the ideal.
Right. That works much better for Christian Scientists. So lastly, we're going to talk about late enrollment penalties.
So we've gone over this a little bit, so we'll be quick with that. Medicare Part A, if you qualify for that premium free Part A, there's not a penalty.
Which most people do, right? We've been doing this a long time. Most everybody qualifies for premium free Part A.
Part B, if you qualify for a special enrollment period or you enroll during that initial when you turn 65, there's not the penalty. Otherwise, we know it's 10% for every 12 months that you should have had it and didn't. And then Part D, if you sign up for it at a later date, you don't sign up for it and you decide in 10 or 15 years, they do charge you a 1% penalty. And what they do is they look at the average premium of a Part D penalty in the United States. If that's something that ever applies, you can always reach out to us.
And I've seen that a lot because people, well, it's only 30 cents or 33 cents a month, not a big deal. Well, if I haven't had a Part D plan and I get one of those, Part C plans that has it, they go, well, let's see, Jim, let's see, that's 10 years times 12, that's 120 months times 33 cents. That's almost $40 a month in penalty, right? I mean, that's a big penalty. And they're going, well, the Medicare Advantage plan, the good news, Jim, it doesn't cost anything. Well, now I know after Nancy, right? Nancy, it's not really Christian Science friendly at a Rinky, and I got to pay a penalty. So it really is. You really have to be a really well-informed consumer before you jump on something and just say, gee, it's free. My mom always used to say, listen, nothing's free, right? Don't buy cheap shoes, don't buy cheap mattress. And when she was right, and you have to look at insurance and go, okay, if you're getting it for zero, there's a reason why, and that's justified by the government. But you have to look and go, gee, is that really going to be beneficial for you? Or you just, it's kind of a knee-jerk reaction. I need to get something. I think this is better than nothing. And all too often, it's not in your best interest. It's in the company selling it to you, right? They want you, Joe Namath, they want you to buy all those plans, right? That's their goal.
So the most important thing that you need to know is you can call or email Jim or myself with any help that you need. Our phone number, our email addresses, and there's not a charge to work with us. The insurance companies pay us to help you. So if you go with a Medicare supplement type plan, something like that, we help you with the application process. And then we're also here to answer any questions or anything along the way that you have. You can also visit our website, whatsmedicare.com.
Right. Again, not affiliated with any Medicare or anything. We tried to put things on there that speak in English, right? Make it simple for people to understand. So that's our goal.
Our goal is just to be here to help to answer any questions or help along the way.
Help educate and enroll. Okay, I think that's it for today. I don't know, John, do we have time for questions today or
maybe Thursday?
Questions? Whoops. Let's see. Great. Here, I'm back on. So we have a number of questions, but maybe we're at 5 o'clock already. Should we just take a couple and then save the rest of them for Thursday? I think we should probably do that. We've covered a lot.
Okay.
So let's just take a couple here. Let me just pull them up. And they're so small, I'm going to have to use my glasses here because they're really small on this monitor. Okay. If you need to stay longer than 60 days and don't have the money to pay the $400 per day, what will happen?
Okay, that's a great question. We we have some wonderful resources available to Christian Scientists to support the desire to rely on God for healing and to have this wonderful support from Christian Science nurses. One of those resources is the National Fund for Christian Science Nursing, and it's administered by the Principal Foundation. And we've had many patients that have been helped by them. It's an easy enrollment process, and they're eager to help those that do have a financial need. So that's one very good resource. They'll even help with practitioner bills as well.
Perfect. Yes. Thank you, Nancy. The National Fund is a wonderful, very beneficial resource. Thank you. The next question is, what happens if Ardenwood moves out of state? Well, that's premature. I guess I can answer that. It's premature, but likely Medicare. That's why Medicare is offered throughout the 50 states and will be in this region. So we won't be that far. But anyway, hope it answers that question.
It wouldn't change our Rinky status.
Yeah.
It wouldn't change our
Medicare
Rinky status. Excuse me.
So that wouldn't change.
Exactly. How does one know if their supplement plan is Plan G? Does this include Kaiser? Who does carry a Plan G?
Kaiser is a Part C plan, a Medicare Advantage plan. So it's just the opposite. Those are the ones we talked about, right? That the part that the Medicare Advantage plan, it's got the prescription drugs built in, and they give you some vision and hearing, things like that. So that's probably not in your best interest if your goal is to receive care at Ardenwood or another Christian Science facility. That doesn't mean go out and drop it. I'm just telling you, if that's your ultimate goal, right, John, that's probably not Christian Science friendly for a facility.
And if I could just add, a Medicare supplemental insurance policy card will say what plan letter it is.
Exactly.
And it's different from a Medicare Advantage. It's Medicare supplemental. That's what the Plan G refers to.
Correct.
And there are different insurance companies: United Healthcare, Blue Shield, Anthem Blue Cross, HealthNet. There's a lot of different companies out there that offer.
But the Plan G is standardized with all of them. So Plan G is the same with company ABC or XYZ. So that doesn't change. We always just look at the claims payability of the insurance company and the premiums. And don't buy cheap, right? Every time somebody buys cheap, it bites you because it comes back and it goes sky high in 4 or 5 years, and you don't know what to do. And most people just continue to pay the premium. So don't buy cheap. Buy something good quality at a reasonable price.
Any companies that we work with have a good track record of paying claims.
Right.
There are a couple of different insurance companies that we are not licensed with any longer, and we refuse to use because every time we had a large claim, we had an issue, and they always presented it as, oh, we're just randomly looking at this claim. But every single time there was a large claim, that's not random.
Right.
So last question, and we'll have these again on Thursday. So I live in Arizona. Is there any Medicare Advantage plan that has Ardenwood in its network, even a plan based in California? And once again, we're really kind of trying to steer people away from Advantage plans, but
yeah.
Go ahead.
I can answer that. The answer is no. So if I'm outside the service area, right? If I live in California, I'm down in Arizona, or moved to Arizona, I would have to get a plan down in Arizona. That would actually be the time. So if I'm on, you'd mentioned the K company, right? And I moved to Arizona, that would be the time I could go back to original Medicare and see if I can qualify for a supplement. But it doesn't matter because you would be able to receive care, right, at a Christian Science facility like Ardenwood. And
Nancy did a great job of answering that question earlier, that there is not a Medicare Advantage plan where Ardenwood is in network on that plan.
Yes.
Or any other Rinky.
That's right. Okay.
Correct.
Yeah.
exactly.
Yeah.
It's very challenging. Well, let's conclude here. And thank you, Jim, Katie, and Nancy. This was so clear and helpful. It's complicated, and that's why we offer these webinars. So please don't hesitate to call in any of these three with Medicare or insurance-related questions at any time. They're all happy to help. One other resource you are welcome to contact is the Christian Science Provider Network, which works directly with Medicare on behalf of Christian Science care facilities like ours, as well as individual Christian scientists. Another resource that Nancy mentioned for financial assistance available to all Christian scientists at all ages is the National Fund for Christian Science Nursing, or NFCSN. The contact information for these resources is listed at the end of today's webinar. Again, the point is that it's wise to be thinking through your options now. That's the purpose of these webinars. Before we go, I want to mention upcoming events this fall. In November, our last estate planning workshops will be on November 1st and 3rd. And a question and answer on Medicare in November will be on November 10th. Once again, we have one this Thursday in a couple of days here. Also in November, we invite you to join us for an online Bible presentation on the law that reveals health, given by Evan McDonald on Saturday, November 5th. Evan's Bible research will inspire new views of a timeless truth. In December, as you know, our annual Christmas celebration is Sunday afternoon, December 4th. We hope you, your family, and friends will join us online. You can find details and register for all our online events on our website, ardenwood.org. So thank you again for joining us today. We look forward to seeing you this Thursday afternoon for a robust Q&A session.
Right.
Same time, same Zoom link. You'll receive a reminder email with a link in it. So thank you and goodbye for now.
Thanks, everybody.
Thank you.
Bye-bye.
Bye.